The top three controlled drug classes of medications that are most commonly abused today are the opioids that are prescribed for pain, the central nervous system, depressants that are prescribed for anxiety or sleep disorders, and the stimulants that are prescribed for attention deficit hyperactivity disorders. According to Opioid Crisis Fast Facts, posted by CNN.com on June 21st, 2020, experts state that United States is in the throes of an opioid epidemic. An estimated 10.3 million Americans starting at the age of 12 years old and over have misused and or abused opioids in the year of 2018, with 9.9 million Americans abusing prescription pain relievers and 808,000 heroin abusers. Today, we will uncover the crisis of prescription medication abuse. We will consider some possible solutions to prevent misuse, and we will determine the benefits if those solutions are implemented. You may ask and wonder, what is prescription medication abuse? That is taking medication that is not prescribed to you. That is taking medication that is prescribed to you by your doctor, but not being compliant with the instructions that is instructed by your doctor on how and when to take the prescription medication, or just simply taking the medication to get high. Serious consequences happen when we take those actions into our own hands and misuse and or abuse our prescription medication. As evidenced by today, we have seen an increase in emergency room visits, an increase in overdose deaths, and also rehabilitation admissions. Overdose deaths involving opioids today have increased 5 times higher from the year ranging from 1999 to 2016, according to Drug Facts Prescription Drugs, posted by teens.drugabuse.gov. Most people will tell you that they take their medications responsibly with no problems. 6.5 million Americans starting at the same age group at 12 years old and older abuse their prescription medication for 9 medical reasons, with an addition of 1.9 million Americans being dependent on and also abusing their pain relievers. According to Prescription Drug Addiction and Treatment of Prescription Drug Abuse, posted by AmericanAddictionCenters.org. Now that we have talked about the crisis in prescription medication abuse, let's talk about and consider some possible solutions that we can take to prevent the misuse of prescription medication. We can play a role in identifying and preventing misuse of medications by asking our doctor, our dentist, and or our pharmacist when getting new medications filled, what is the outcome of me getting addicted to this medication? What interactions will this medication have with my other medications that I am currently taking? And just asking, what side effects can I expect with taking this medication? According to Prescription for Disaster, posted by How Teens Abuse Medication, the 3rd edition, posted in 2015. If you know someone that is abusing medication, or someone comes to you that needs help with the struggling of misusing their medications before it comes to a abuse or addiction, you want to be aware and understand what to expect with this medication abuse. Educate yourself on the side effects and the interactions and how to go about getting help for that person. Today they have stored some disposal bins, and they have disposal guidelines for you to discard your medications that are no longer in use. We get in the habit of putting medications in our medication cabinet for just in case. Those medications stay in the cabinet for long periods of time. We now have to get rid of those medications by bringing them to our local pharmacy, our local hospital, and or the police station. They have a bin where you can dispose of the medications properly and not flushing them down the toilet or throwing them in the trash can. According to Drug Enforcement Administration diversion.usdoj.gov. Now that we have talked about the possible solutions that we can take to prevent misuse and or abuse of prescription medications, let's discuss the benefits if those solutions are implemented. We tend to carry on remedies from our old family members. Today they have counseling for family and individuals. And also now the cognitive behavior therapy that is provided for people that go in for counseling. All of those are most effective now than misuse and abuse of prescription medication.